Welcome, everyone. We are live. This is Level-Headed Mind, as many of you know. We are doing questions for, answering your mental health questions. So if you have questions, go ahead and go put them into the comment section. Now, we do have priority orders for members, super chats, and then we go in order after that. So Raul is working behind the scenes. He is my video editor, and he is helping to bring the questions up. So that's how things are working here. So just would like to welcome you and also let you know that this live stream does go on for 2 hours. So it is 11 a.m. Eastern Standard Time. So by 1 p.m. Eastern Standard Time, we'll plan to close. So just to keep that in mind with your questions and answers. The ones that I don't get to answer in the end, I do pick like 3 or 4 of them and we'll answer them in the newsletter. So if you're not subscribed to the newsletter, go ahead on levelheadedmind.com and you can subscribe to our newsletter there and get to see all of the questions, unanswered questions, as well as some other information and articles that I share. So welcome. Do we have any questions now? It looks like we have some people. We have a new member. So welcome. Buffy is a new channel member. Thank you so much. I really appreciate that. And her question is, does antipsychotic induced akathisia always need to be treated? Will it get worse if left untreated? Yeah, akathisia and antipsychotic induced akathisia can be very problematic and troubling, and it absolutely needs to be addressed. It's not one of those symptoms that goes away. It actually does get worse. And when it comes to treatment, typically, reducing the dose of the antipsychotic that caused the akathisia is usually where we would start, conventionally speaking. Switching to another antipsychotic that perhaps would not have this as a side effect for you, and or sometimes sedative medications like benzodiazepines are used to treat akathisia, though I wouldn't recommend that because there are issues down the road with that as well. And it's just putting a Band-Aid on it. So really the issue is the antipsychotic medication itself. And so the best way to go about this is to reduce the dose, see if that helps. If not, look into switching the medication altogether to something different to help. But that's a really good question. And thank you for being a member. All right. Hello, Ganesh. Good morning. As a psychiatrist, do you believe in hypnotherapy and NLP? And do you recommend to your patients? What's your view about NLP and hypnotherapy? I don't use hypnotherapy in my practice. I don't have anybody, and I'm not sure what NLP is. It's not coming up as an acronym that I am aware of or that I know of. It's not that I don't believe in it. It's just that I don't work with any practitioners in my practice, in the office that I work in, or have any experience with therapists that do hypnotherapy. I have heard that it can be helpful. So, if that's a path that someone wants to go down, certainly there is some research on it. And I know of some people who have used hypnotherapy to come off of drugs and quit smoking and things like that. Neuro-linguistic programming. Yeah. I don't have anybody that actually specializes in that. So no, but certainly the research is out there to support these types of therapies and things that can happen, especially in the subconscious mind, to help people, like I said, quit smoking, quit using drugs, and also for people with trauma. I know that those types of therapies can be helpful, just don't have any experience with them. As a psychiatrist, do you recommend L-theanine supplement for ADHD standalone without caffeine? Is L-theanine effective alone for ADHD, or doesn't it cause drowsiness? It can. And I'm a psychiatric nurse practitioner, just to make that clear. I never want to be accused of posing as a psychiatrist or a doctor. I'm a psychiatric nurse practitioner. But anyway, so L-theanine, for some people can be a standalone treatment for ADHD. I've seen L-theanine on its own work wonders. Usually it's paired with magnesium L-threonate to really help. And the drowsiness aspect of it, when it comes to ADHD, your mind is overactive. And so quieting that overactivity down actually is often beneficial for people with ADHD. And so they usually don't experience the drowsiness. They actually experience the flow and the focus state that L-theanine helps to provide them, with. Now you can also pair L-theanine with other things like nootropics. There are various nootropics and polyphenols and things to help support brain function as well, but it can be used on its own for ADHD. I have ADHD. Is it possible to stay in the present just with the help of therapies without medication? How much improvement can expect? This is case by case. There are many people out there, my husband actually included, that, so I have firsthand knowledge, that have ADHD and don't take medication and just use tools and things like therapy to help keep them focused. So some tools can be like organizational tools, calendars to block your time. He likes to use specifically like breaks. So he'll have 2 hours of work and then schedules in, a 10-minute break. And his work is very flexible where he can do that, step away, come back, to work for 2 hour blocks. So sometimes that helps people. During the breaks, just kind of refreshing the mind, maybe doing a meditation and things like that. So there are a lot of therapies, but also tools and skills where you can actually help with the focus and concentration aspect of things and not get so distracted. And so it's just a matter of personalizing that, and that you could do with the therapist to kind of figure out what your primary symptoms are, as well as figuring out where the distractions lie and how you could best handle or mitigate that. Is therapy only, or using these skills only, going to help everyone? No. Some people do need medication or supplements to kind of help get them over the edge and help them, with the ADHD symptoms. So it's case by case, person by person. And I also emphasize checking for nutrient deficiencies as well, because oftentimes that can be a problem. So looking at zinc deficiency, copper excess, and vitamin D deficiency, omega-3 deficiencies, very common with ADHD patients, I've noticed. And then magnesium as well, and even a subclinical magnesium deficiency would state to me that you would require and benefit from magnesium supplementation. And then after accounting for that, your B12, your folate as well. Then looking at supplementing with nootropics if needed, and using things like L-theanine and pine bark extract and curcumin and things like that to help support the brain as well. So yeah, you can do the therapies, and that could be helpful for some people as standalone. Others will need a little more support. Rohit, hello, Rohit to the core. Is schizophrenia patient stable on medication is eligible for disability certification from government? I don't know. I believe that is going to be state by state on their requirements. I'm not exactly sure how it works with disability. I don't do disability cases. So that's not something that I'm very familiar with. I do know that schizophrenia as a diagnosis, you do have a higher likelihood of getting acceptance into disability, but you do have to prove that there is some level of um, disability or dysfunction in not being able to work to your capacity. So whether, if you're stable on medication and you're doing well, then obviously with that, you might get partial disability because maybe you're doing well enough to work, maybe at a grocery store or something like that. But your job before you were diagnosed with schizophrenia, maybe you were doing some kind of high tech work that now you can't do because the higher functioning processes of your brain aren't functioning well. So yeah, you could have a case for that, and they may grant you like partial disability. So it depends on um, what level of functioning you had prior to, what kind of work you were doing prior to the diagnoses, and then how the diagnosis is affecting your ability, to get work and to get the same kind of work that you were doing prior to the diagnoses. And with that, with disability, oftentimes I do know that patients get denied the first or even second time that they go through the process. It's just the way our system is, unfortunately, here in the US. So you may have to apply more than once for it. And like I said, even people who are not working and really debilitated because of their mental health conditions usually still get denied the first time around. So it's best to speak with a lawyer about it, going into it and figuring out how you can approach the disability process when you have any mental illness, for that matter, that's affecting your ability to work. Okay, hi Eric. What is your opinion on psilocybin mushrooms on treating depression or PTSD? Well, the research out there, or the research that's being developed for using psilocybin, um, is using in very, very low micro doses. So this is typically then, compounded, to make some kind of consistency in that dosing. Um, from what I understand, what's out there for the majority of people now, because it's not like FDA approved as a substance, to my knowledge yet. I know they're trying to work on standardization, to make it an approved like medication. The standardization isn't there, so if you're getting mushrooms from the street, depending on your source, I don't know the doses that you're taking, and so it's hard to back something up like that doesn't have standardization. So when you're using things like psychedelics, like psilocybin, and there's other psychedelics out there as well, that people, claim really good benefit, and I don't doubt their claims. What I'm saying is that you can't put that as a widespread generalization and saying that it's going to help the masses, until you do the research and you have a standardized formula of that substance and say, like, yeah, actually, we've had this many people go through that have depression and it helped bring their scores down this much, and we use that with a control group that didn't have the psilocybin, et cetera. So using like a randomized control trial, which is what they're trying to do right now, and they're in the process of doing, to help. So my opinion on it is that it can be helpful for some people. I've had patients who went on their own to do psilocybin microdosing, and they saw some therapists that were trained in that, and there are states that actually make it, legalize it so it's not criminalized. Michigan, I believe, and Colorado are two states that come to my mind. But that being said, it has been helpful, but they were in a controlled environment and working with a therapist. So that has to be countered in as well with it. So is it going to help the masses? Um, as long as it's standardized and done in that way, perhaps it can. But just going out on the street and getting mushrooms and saying, hey, this is going to help my depression. or PTSD could actually do the opposite. Because taking too much, when you go beyond microdosing and now you're having hallucinations and that can actually be very traumatic, and that can be trauma inducing and can actually flare up a lot of your symptoms of PTSD, and may even make depression worse. So I think the takeaway is, if you're going to try something like that, make sure you're doing it in a controlled environment, working with a professional who understands how to use these substances to help people break free from their mental health symptoms. But good question to bring up. Awayas, hello. What vitamin is good for brain and eye nerves? So when we're looking at eyes, beta carotene, the vitamin A, very, very good for eyes. And then your antioxidant supplements are going to be good for both brain and eyes. So like vitamin C, vitamin E, and things to support the brain that have polyphenols as well can be very helpful for both brain and eye health and nerves. There are many supplements out there that have both, that have I think they have like their eye vitamins or specific vitamins for eyes. And you could pair that with other things to support brain health specifically. And even things like omega-3s. I always forget about including that because omega-3s are anti-inflammatory. So if your nerves are being damaged because of inflammation, omega-3s can also be very powerful. So it's not just always vitamins. You could also use, high potency omega-3 supplements to help with brain health and even eye health and nerves in general. Hello, Awayas again. Okay, I have been on amitriptyline since 2010. Whenever I wake up in the morning, my face and glasses are covered with oil. I had fatty liver issue before due to olanzapine. Um, I haven't heard of this happening. Only thing is I can think of with amitriptyline that could perhaps cause something like this is the sweating, like the night sweats that can happen as a side effect because of the norepinephrine. And maybe that causes like the sweatiness on the face. Um, so I'm not sure if you're waking up and you're like, are you sleeping with your glasses on? But maybe when you put your glasses on, you notice it. But that's the only thing I can think of. I don't know any correlation with fatty liver and amitriptyline. Fatty liver disease can develop because of metabolic syndrome, which is how I could see how olanzapine can lead to something like that, because it can increase your lipids and liver enzymes, etc. With amitriptyline, I'm not really sure on that correlation. I'd have to look into the research there. But what comes to my mind when thinking of like oil or like sweatiness is like the night sweats that can happen with amitriptyline as a side effect. So maybe that's what's happening. But certainly speak with your provider or your doctor about it. It's very interesting. Hello, Skelly MC. Kind of interesting question. Have you ever experienced someone get better from anxiety, agoraphobia, or panic attacks from using Wellbutrin? Yeah, Wellbutrin, this is interesting, but I have seen it happen. Um, Wellbutrin is primarily a dopamine norepinephrine reuptake inhibitor, and it's which can be stimulating. It's not categorized as a stimulant because it's not directly flushing the brain like the stimulants do with dopamine or norepinephrine. But because it is indirectly increasing it by the reducing the reuptake, um, it can be stimulating for some people. And I have seen people with anxiety, and particularly when you have anxiety and like ADHD on top of that, get better. Um, because of the way it's helping you to focus and concentrate. So low dopamine in and of itself, usually creates problems with depression, low mood, low motivation, And if you have that along with some of these symptoms, perhaps that can be helpful. When I think of agoraphobia and panic attacks, I think of an overstimulated nervous system and needing to do things like nervous system, regulation. And so I would want to focus in on doing that first before giving someone something like Wellbutrin, just because we could potentially create an environment of more hypervigilance and a nervous system that is overactivated even more, and perhaps even cause a burnout type of scenario with the adrenal glands. So at any point in time when I do have someone who has significant anxiety, Wellbutrin is not my go-to standalone. I would want to help to manage that person's anxiety first, and whether that be by medication or using nutrition. I always start with nutrition first anyway in my practice, looking for deficiencies, supporting them with supplements if needed, and then utilizing tools and skills to lower nervous system activation. Things like slow movement, stretching and yoga and vagus nerve exercises and vagus nerve stimulation, etc., deep breathing, meditation, etc., to get their nervous system calm. And then utilize something like Wellbutrin, but with Wellbutrin right off the bat with someone who has high anxiety state and is as having panic attacks, can actually be very dangerous and risky. So, but I have seen Wellbutrin help people with anxiety, and mostly anxiety mixed with depression, anxiety with ADHD, those kinds of symptoms. But I would hesitate to just use that as a first line treatment for treating someone with anxiety and panic attacks and agoraphobia. Hello, Chuma Doshi. A good mediation, or do you mean meditation for psychogenic GD or ED? Can mirtazapine help? Okay, maybe you mean a good medication for psychogenic ED, erectile. Okay, can mirtazapine help? Mirtazapine in higher doses, you are getting some norepinephrine benefits, so that could potentially help ED. But when we're looking at psychogenic ED, which is like a psychogenic, psychological type of erectile dysfunction, um, we tend to use other medications like bupropion, for instance. That's going to be more directly stimulating, because mirtazapine, though it does have some norepinephrine properties, when you especially get into the higher dosages of mirtazapine, um, it does have a risk of sexual dysfunction as a potential side effect. So that wouldn't be my go-to there. Um, and if this is medication induced, there are things to do that. But if it's psychogenic induced, then I would be looking at therapy first and foremost, and figuring out what is causing that, when we're thinking psychologically speaking, and this is not medication based. Before using medications, I would start with therapy first, and then if we needed to use medications, psychotropic medications, I would be looking at things like bupropion, and even buspirone has shown some efficacy with sexual dysfunction and erectile dysfunction. But the mainstays for that are going to be things like Cialis and Viagra, and those types of medications, have more efficacy than the psychotropic medications do. So talking to a urologist would probably be a good person to talk to about this, to see, as far as using medications to help treat this, what they can do. But I would start with therapy first and see if this could be trauma based. And therapy could really be helpful there. All right, Annie. Hello, Vraylar for benzo withdrawal. Oh, I would not do that. Vraylar is an antipsychotic. And when we're looking at benzo withdrawal, that's a whole other animal. I don't like to use psychotropic medications with patients in benzo withdrawal, um, unless like it's absolutely necessary. And when I do use medications, I tend to use those with low risk of stimulating someone. Vraylar has a very high risk for akathisia. I would never use Vraylar in someone with benzo withdrawal, just because without the benzo factor and withdrawal factor period, I've seen that actually, cause significant problems in patients, um, long term, especially in the higher dosages. And it would depend, I guess, too, on the symptoms of the benzo withdrawal, but certainly isn't my go-to. I would use things like hydroxyzine, medications that are benign but can calm the nervous system down. Maybe clonidine or propranolol, things that are not that are going to help with the nervous system, calming them down, the sympathetic drive, calming that response down, but not being another substance that they would then have to like be very, very prudent with tapering off of. That's why I don't like to use antidepressants in benzo withdrawal. Though there are patients that will, come with both antidepressants and benzos, and, they'll say they're already tapering off their benzo. We don't mess around with that antidepressant. We leave it there and then, taper them off of the benzodiazepine very, very slowly, and then use things to help calm the nervous system. So again, this goes back to using things like vagus nerve, massages, vagus nerve stimulation has been very helpful for many people in benzo withdrawal. Um, Other things to calm the limbic system down. So like meditations, very helpful, even if your mind is wandering a lot. Just the exercise and practice of trying to bring your mind back to the present, very helpful for brain-derived neurotropic factor, neuroplasticity, and making new connections. So all of those things are going to be more beneficial than a psychotropic medication, which can alter the brain chemistry even more and create potentially even more withdrawal symptoms and effects. So that's what you have to be careful with when you're thinking about adding in medications to someone in benzo withdrawal. Buffy, hello. Can Prazosin be used during the day to treat PTSD? It can be. It's used mainly at night because it has sedative properties and can help people who have nightmares with PTSD. So you could try. Some people can do low dose Prazosin during the day and not feel too sedated, but that would be the one thing that you would just be cautious about is the sedation and also lowering the blood pressure too much. So you want to make sure you're checking your blood pressure and seeing how it affects you. But it can be used during the day, and I've seen that used during the day, and actually have a couple patients with PTSD that do use it as needed during the day when they start to become hyper aroused, and they do fine with it. So yeah, it can be used during the day for people. It just depends on how you respond to it. Obviously, if it makes you too sedated, you probably want to try something else. Maybe a propranolol might work better. Or hydroxyzine low dose could work better for you. But yeah, it can be used. Unknown aspirant, hello. Hello, ma'am. I'm suffering from major depression disorder, and even I don't know who I am. Please help. I'm going to die. Well, I'm sorry you feel this way. Suffering from major depression disorder, well, you don't have to do it alone. Look for resources in your area. There are links and resources in the description of this live for our suicide hotline here in the U.S. And then there's crisis numbers here in the U.S. It's 988. It's a very simple number, so you could call there to get some help, so that you're not alone. And then if you're in other countries, there's a link that takes you to a site where you can type in your country that you're in, and it'll give you some numbers that you can call for crisis line that's going to be similar to our 988 crisis number here in the US. But I certainly do feel for you, and I can understand how being in major depression that you feel that you're suffering and this, this ideation of wanting to die, but there is hope and there is help out there. So I really encourage you to reach out and get that help. And it sounds like you're asking for help. And so definitely go ahead and utilize those crisis line numbers and get the help that you deserve. Okay. So that goes for anyone out here that's watching and suffering. Use the crisis line numbers 988 here in the US. And there's a link in the description for out of country crisis line numbers if you're not in the US. So I would definitely say to utilize those resources. Hello, Ganesh. What supplements do you use as a psychiatrist, doctor, psychiatric nurse practitioner when you need to focus more and during your resident studying? Um, so supplements that I use, particularly, especially if I want to increase my focus, increase my attention on a certain thing, is I like green tea. I've talked about green tea before, and it has EGCG in it. It's a really good component, and also L-theanine as well. Um, that can be very helpful for people. We mentioned L-theanine. We mentioned um, what's the other one? Polyphenols. So OPCs, oligaric polyanthocyanidins, I believe is the term for them. And those are just basically the polyphenols that are concentrated in things like grapeseed extract, pine bark extract, and things like that to help the brain function. I also use B complex. Um, I use, multivitamin that has high levels of the B vitamins. I use Pure Genomics just because of my genetic predispositions. And then things like omega 3s, that's like daily for me, my omega 3s. And then if I want to leverage a little bit more specific on brain energy, I may use some nootropics. Like I said, the green tea helps a little bit, but if I want a little bit more, I'll use some different nootropics like the grapeseed extract, lion's mane. There's a powder that I use called Amari Edge. And they actually have one now, Amari Edge Plus, that includes lion's mane that uses nootropics. So I'll use that to help with focus and attention and those kinds of things for studying, etc. And that is part of a mix that you could do by itself. It's a really good nootropic by itself, but you can also mix it with their Mood Energy Plus and their Mentobiotics, and they call that happy juice, which I love. And so, yeah, I would use that for a boost for myself. And that's the Amari Edge or Amari Happy Juice. And that's just basically utilizing various nootropics, adaptogens, and pre and probiotics to really help the gut-brain axis and to support mental energy, mental flow. And so, yeah, that's what I use personally. For patients, I mentioned that to them, whether or not they want to use it, because that's actually can be very costly for people to use on a regular basis. But, I look at things like OPCs, so a product called Curcumisorb Mind by Pure Encapsulations that has a lot of good OPCs in it to help with brain function, focus, concentration. You could also use things that particularly help with dopamine in particular, like specifically. So like Dopa Plus by Pure Encapsulations. Another one I like is Dopatone, and that's by Apex Energetics. And so for people who we know, like they need dopamine support, like after looking at their oats test or maybe a neurotransmitter urinary test and looking at, their serum lab values and seeing what nutrients they need to support those conversions. We kind of use various nutrients, multivitamins, sometimes just zinc, and folate they need, or sometimes it's zinc, magnesium, folate, and B12. So it really just depends. It's individualized. But once you get their nutrients repleted, then you could use these other things and adaptogens and supplements to help. But there's a lot out there to really help with focus, and it's you're going to have to try out for yourself what's going to be beneficial for you, unless you're working with a provider that can do focus testing to kind of dial in on what you really need. You're going to have to do a lot of guessing in that department to figure out what's going to be what's going to work specifically for you, because what works for me may not work for you and or the next person. Hello, Skelly. Yeah, microdosing psilocybin was great for me for 1 to 2 years until it made me have a really traumatic event where I don't want to use them again. Yeah, that's the risk with these psychedelics. Um, with getting into that realm of, overdoing it, or even maybe just that one time you do it, you get a bad experience. Maybe you end up taking, unfortunately, a little too much or something, and that can be very traumatic for people when you lose control. Because when you take a psychedelic, you're in a very vulnerable position, extremely vulnerable position, um, especially when you're actually in that place where you're quote unquote tripping, and your mind is out of itself. Um, you lose control, and that is very traumatic for people, and your mind can go into a lot of different places. So unfortunately, that is the downside to it. And like I said, if you're going to use it, make sure you're doing it with an expert, someone who knows what they're doing, a therapist who can help guide you through the process, to help avoid these things. But even in those situations, I've heard of people, and this can happen even with ketamine, where people really go down with that, even in a therapeutic environment, and that can be very scary. So that's the risk. You got to weigh that risk benefit with all of these treatments. Abhishek Shaun, what causes weakness in B12 neuropathy? As I'm adult 23 and having severe weakness from last 6 years, tried many times psychiatrists but didn't help. I have severe restlessness and like not calm my brain. And B12 neuropathy. So I'm guessing you may be having a B12 deficiency that's causing a neuropathy. So B12 is an important nutrient for brain health, brain function, period. And so when you do have a deficiency, especially one that's causing symptoms, you need to replete the B12. You may need, actually, depending on your levels, to do systemic repletion, meaning going with injection or even intravenous to get benefit. So it would be good to know what your levels are before determining which direction you go in, because oral dosing of B12, especially if you're severely depleted, isn't going to do much. You want to get it absorbed more systemically. And it's also, depending on why your B12 is low, oftentimes it's because people can't break it down in their stomach. They're missing perhaps an intrinsic factor or something like that. And so that would certainly require injections and systemic absorption via intravenous or injection form, going directly into the blood. Some people can find benefit systemically by sublingual, so that's under the tongue, where you can take B12 in liquid to try to get benefit. Now, other things that you can do is, maybe B6 you might need to help. B6, we have to be careful if we do too much. That can also contribute to neuropathies. But low B6 can also contribute, so there's a fine line there. So utilizing some of the other B vitamins like folate and B6 could be helpful. And then the omega-3s, like I mentioned before, very good for dampening down neuroinflammation, brain inflammation, so that you could perhaps find some benefit. And then magnesium glycinate can also be very calming in the body and the brain. Magnesium L-threonate um, crosses the blood-brain barrier, will get into the brain more readily, but glycinate can also help too, and in my opinion is more calming. But you could utilize either form of magnesium to help to calm the nervous system down, and then focus a lot on vagus nerve, calming the nervous system down that way, doing things like meditation, slowing the mind down, slowing thinking, um, vinyasa kind of like yoga practices where you're doing slow stretching, slow movements, being in tune with the body. That actually is incorporating not only body movement, but mindfulness as well, as you have to focus in on your feelings and sensations as you're going through those different stretches. So, lots of things to do to help to calm the mind down. But if this is specifically attributed to a B12 deficiency, you're not going to be able to get repletion with oral. You're going to need most likely intravenous or intramuscular. Sublingual may or may not work or help, but certainly see a provider, make sure you know your levels, and go from there. But it can be very debilitating just because B12 is necessary for many functions in the brain, for the myelin sheath, for synapse conduction, for nerve conduction, all of those. I mean, B12 is very, very um, uh, a nutrient that's very, very important, and foundational for brain health, and nerve health. So that needs to be repleted and looked at by a doctor. Okay, Daydreamer, hello. Hi, ma'am. Can I use olanzapine or clozapine for my treatment-resistant depression at low dose of 25? Clozapine can be used. Whether or not you can use it is going to be up to you and your doctor. I can't really say for you whether or not you can use it and whether or not it's going to be helpful. I know here in the US, with clozapine, you have to be enrolled in the REMS program, which is like the risk management program that's looking for, you're going to have to get blood drawn frequently to look for any blood dyscrasias, and particularly looking at CBC, white counts, things of that nature, because that can occur with clozapine. So, I don't know if you're in the US, but that's a factor. So you're gonna have to find a provider who uses clozapine and is in the REMS program, to do that for you, to monitor that. But because of that here in the US, it's not something that is readily used or utilized, because it's a barrier, um, an extra step that a provider has to do, which can be for the provider, labor intensive with paperwork and submitting, what's required to be in that program for the monitoring, and then for the patient too, having to get blood drawn every few months, can be an inconvenience. So it's not, something that is readily used, but if it is used, you have to use it with the provider who is obviously trained in its use and is registered in the REMS program. But it can be used technically for treatment-resistant depression. And even at a low dose, you would still have to go through the REMS program here in the US. Hello, Jenny Flores. Severe anxiety after Trintellix stopped working after Monjuro. Tried Lexapro, didn't work. On Viibryd for 5 weeks, tiny bit of improvement. Is it worth waiting it out? Oh, so Monjuro, this is very interesting. In my members section, there's a presentation I did on the GLP-1 agonist. It's about an hour long, I think, but I did extensive research in this because one of the members actually, I forget which one, it might have been Monjuro, started one of these and had some symptoms of anxiety, I believe, or depression. And so I started looking into the psychiatric effects of GLP-1 agonists. And what I found in that overall, like looking back at that research, is that these GLP-1 agonists can cause some anxiety, However, the direct mechanism is unknown except for the fact that what they're hypothesizing is that the blood sugar, because maybe you're dropping the blood sugar too low, that could be causing the anxiety because of the low blood sugar symptoms. And then, starting that sympathetic nervous system response, because obviously then cortisol comes into play. So that could be a mechanism that, it's attributing to anxiety. But there have been some reports of people who don't have the low blood sugar but still experiencing the anxiety. So that's why they say it's not completely understood as far as that goes. And also, there's a factor of suicidal ideation with these medications that they're still trying to figure out what that mechanism is or why these medications are causing that. So, bottom line is that there are some psychotropic or psychiatric side effects that are still a mystery, and we don't completely know why. So I can't really say whether or not these SSRIs are going to combat these effects that you're getting from Monjourno. It's a possibility. If you are seeing some effects from Viibryd 5 weeks in, it's worth it to go 8 weeks, sometimes even 12. Sometimes it does take a little longer to see benefit from psychotropic medications, and also make sure that you're on a good therapeutic dose of Viibryd. Maybe 30 milligrams would be a good dose there to be on. So if you're on a lower dose like 10, maybe consider going up to get benefit. And then also, because for me, what I think about when I think about modulating these things in our body is digestion, nutrient absorption. Is that being affected? So in that case, make sure you're doing your lab work and looking for the nutrient cofactors for serotonin, specifically for anxiety, and making sure that you're not depleted in your amino acids. So I would do like a fasting plasma amino acids, and then look at your B12, folate, look at homocysteine, because that's going to be more telling than just B12 and folate numbers, especially folate, because that's also detecting folic acid, which is synthetic, and we want folate, not folic acid. And then looking at your zinc, your copper, making sure that's not too high. Who knows what's mixed in with these injections, especially if you're getting them compounded. So those are the areas that I would be thinking of first, and then seeing if we have any deficiencies, and then supporting your nutrients. And then perhaps you may gain more benefit from something like an SSRI or a multimodal like Viibryd, like serotonin multimodal medication. But it may be worth waiting out too, because 5 weeks is not, if you're not getting any benefit at all, still wait, maybe push the dose up if you're not already up at a good therapeutic dose, but then certainly wait at least 8 weeks before calling it quits. But you should start noticing some effects. And you're saying a tiny bit of improvement. So that tells me it's worth waiting out, and perhaps even increasing the dose. But also looking for those root things that I mentioned, okay? And making sure that this isn't related to nutrient depletion. So check that out too. Abhishek Shahun, hello. Why weakness and burning sensation in palms? Okay, so this is going back to the B12 thing. I don't know. It's going to be depending on the level of deficiency. Some people have it all over their body. Some people have it just in their legs. Some people have it just in their arms, or their palms. So again, that's something to discuss with your provider. Either neurologist would be a person I would be looking at consulting with if I had any type of B12 related neuropathy, and look for treatment for that. But why in certain areas and not others, I really don't know. And I'm not sure, we know as a collective group of providers, practitioners out there, why certain people only get it in their legs, others in their arms, others in their hands, their palms. But maybe a neurologist would know. Okay. Jillian Komornik, hello. Suggestions on medication for ASD. I've tried risperidone and aripiprazole, but I had to stop due to adverse effects. I'm on Rexulti now, but it's similar to aripiprazole. Yes, it is. With autism spectrum disorder, there is no medication for it. The medications that are out there are to help with the irritability associated with autism spectrum disorder. However, what I would say is that something that has been found very common with ASD are going to be food sensitivities to to food colorings in particular, gluten and dairy as well. That could actually be more beneficial than medications. And then something called HPHPA, which is a bacteria, a Clostridia bacteria found in the gut that you can test with an oats test, an organic acid test, um, that if that is elevated, is neurotoxic and known to cause a lot of neurological symptoms, including irritability. Irritability, anger, frustration is one of the most common there. And you see it a lot with patients who are diagnosed with autism and OCD as well. So that is something to rule out. And an oats test is going to give you a lot more than just the HPHPA marker. It's also going to look at the way you're metabolizing and breaking down your serotonin and dopamine, which can also affect your irritability, anger, and those types of symptoms that can be present with ASD. Now, the other thing I want to mention about HPHPA and Clostridia bacteria is that it actually disrupts dopamine beta hydroxylase, which is the enzyme that breaks down dopamine. And so you can end up with too much dopamine in your system, and that can cause irritability, agitation, OCD like symptoms that are often found with ASD. So you want to tame that down and get that cycle going. And in the oats test, they actually show you the cycle of dopamine breakdown and where all of these factors are what they're looking at in the test and how it actually affects that cycle. Another thing I like on the oats test that could be a significant factor with someone with autism and someone who's having these types of issues is quinolinic acid. That's another toxic byproduct of actually tryptophan metabolism. So we think of tryptophan as, oh, it converts to serotonin, but not necessarily, especially under stress. Tryptophan can actually be going down the quinolinic pathway and creating inflammatory and neuroinflammation, which can lead to high anxiety states and irritability. So if I see quinolinic high on the oats test, that we got to dampen that down, and we've got to figure out where the breakdown is going on there. Sometimes it's B6, sometimes it's copper, vitamin C, all these things you can really identify there on the test. Sometimes it's MTHFR. We can kind of gather that from there's a folate marker on there and a B12 marker on there. There is a methylation marker. There's also it could be detox related. So it's looking at your glutathione and your NAC. So you get so much information from the oats test that anytime I have someone with autism, and especially when medications aren't really working or they're getting all these side effects, I think first right away of food sensitivities, allergens, let's get rid of those. And then what's going on in the gut? And if you do have inflammation, like by HPHPA, you need to get rid of those inflammatory foods anyway. Get rid of gluten and dairy for at least a couple of months before, so you can lower the inflammation in the gut, treat it with, high dose probiotics, and then, retest and see where the levels are. And you may need antibiotics depending on the level of HPHPA. But yeah, that can be a factor in and of itself. And that's one that I like to look for in patients with autism, but also just doing the oats test in general, you get a whole lot of information. So not just HPHPA, but also methylation, metabolism, neurotransmitter synthesis and breakdown, and like those detox pathways as well. So very good, good overall test, for people suffering with mental health symptoms, but particularly those with autism. So I would say that I wouldn't go down the medication route with you. I would be looking at these other factors because that's probably most likely what's happening here, and not anything. Your issue isn't a risperidone deficiency or aripiprazole deficiency or a Rexulti deficiency. There's something else going on, and we often find that with autism. Muhammad Faizan, hello, Muhammad. Maybe as you know my bipolar history, I'm excited to tell you that I'm feeling very well before. Currently, I'm settled on quetiapine 300, paroxetine 25, lamotrigine 400, and Depakote 250. That's great to hear. I know you've been struggling with this. Only one concern. I still have ED and my testosterone also very low. Please guide me on this or suggest any supplement. Yeah. So if your testosterone is very low, this is probably related to that. But it can also be related to some of those medications. So it's hard. I have to be careful with the guiding part because, I'm not your provider practitioner. So you certainly need to run this by, your provider. And especially with the bipolar, a lot of the things that we use to boost testosterone, like Tongkat, mucuna purines, and things of that nature, can also boost dopamine, and in bipolar might kind of switch you over into more of a hypomanic or manic state. So you really have to be careful with these kinds of supplements. So I would say instead look to perhaps maybe increasing circulation, maybe by exercise or lowering inflammation with an anti-inflammatory diet, seeing if you can get any benefit there, and talking to a urologist in particular about things to help increase blood flow. Stuff, things like I mentioned before, like the Cialis and the Viagras, maybe low dose of that could be helpful, but I'm not sure if combining either of those with your medications, if there's interactions. So that would be something that would be in the back of my mind. But you have to be very cautious in the supplements that you use for treating this, just because a lot of them, even Yohimbe is another supplement. Tongkat, and I said mucuna purines already. Those are the top three I can think off the top of my head. But they can increase dopamine as well. And so with that, yes, it can help your low energy levels and those types of things, but it might, go a little too far. And you just have to be careful with switching to hypomania or mania. So you're saying I have low energy levels and the doctor said cut it in half. Means go from 300 to 150. Is it a good approach to treat energy levels? But my mood is stable on 400. I'm a little nervous to make it 150. Which medication is that you're at 400? I'm sorry, I don't remember. Lamotrigine and cutting that back? Yeah, you gotta be careful with, well, you know what? What he's saying actually with Depakote and lamotrigine, you probably do need to go back. That's probably too high. And the reason being, because when you add Depakote with lamotrigine, you're actually slowing down the metabolism of lamotrigine. So you're going to have higher levels of lamotrigine in your system. So that's actually really high when you add in Depakote. So your doctor's actually right about that. You are going to want to start going back on the lamotrigine when you add in Depakote with lamotrigine. It's a very tricky combination. So I would say he's right about that for sure. And that, too much lamotrigine can have a lot of problems and cause low energy and things like that. Quetiapine at 300 could also be contributing. Make sure you're taking that at night. Um, because that could be contributing to the sedation and the low energy. Yes, but I'm more worried about that lamotrigine um, at 400 and the Depakote at 250. That's because that's basically like getting like 800 of lamotrigine, which is super high. So you want to bring that down. Yeah. So anytime you're adding in Depakote or Devalprex with lamotrigine, you're basically doubling your lamotrigine. So you do need to cut that and scale back on that because that can cause problems. Okay. Next, Jenny Flores. Hello. I contacted your office to get a consult on my current lab, but didn't hear back. So I was hoping to find out how to get labs evaluated. Yeah. So I think it's under my video, Labs for Mental Health. There's a link to a lab uh, store, where you can order them. It depends on what state you're in. I believe New York, New Jersey, and Rhode Island are the states where some of the labs you won't be able to do. If you're in other states, you could order the labs directly. Now, if you had, I think someone did tell me someone had asked about their doctor ordering the labs. If your doctor orders the labs for you, the ones that I recommend, and you want a consultation to go over that and review like how it can help you, you could do that on the contact section of the website, levelheadedmind.com. Under contact, there's a link to my calendar where you can actually schedule a consultation. And then when you submit you're going to fill out paperwork and all of that. And then you can actually then also, email me through that email that you get your information, like the links to your forms, email that back with your lab work. I'll review it, analyze it, and then go over it with you in your consultation. So that's how we could do that. So yeah, you would just have to log in levelheadedmind.com. If you want to do just the consultation and you already had labs done, you would go to levelheadedmind.com contact and then look at the schedule there. And this is if you're out of Florida. If you're in Florida, we need to go through Lighthouse Health Group, where my collaborating psychiatrist is here. But if you're out of Florida, which I'm thinking that's why you're saying you called and they said, we couldn't get you on my schedule there, is because you're out of state, you're out of Florida. So we would need to use Rupa Health Labs, which I have the link to that in that one video. And you could order your own labs there. And then you get a 1-hour consultation with that one package. Or if you already had your provider order the labs, you could just go directly into the calendar and schedule the consult that way. All right, Andy O2, hello. I was finally able to get off Ativan. Thank God I wasn't on a high dose. Good. I still take Zoloft and clonazepam. Okay, so clonazepam is another benzodiazepine, but if you were able to get off lorazepam, that's good. And if, depending on how you're feeling on both Zoloft and clonazepam, if that's what's working for you, that's great. But just know that there are similar risks with clonazepam as with Ativan or lorazepam. So that's just something to keep in mind. As you continue on in your treatment and perhaps, as you start getting better, only be on these medications for short term. And then, because the shorter you're on them, the less time you're on these medications, the easier it is to come off later on when you're feeling stable, and meaning you don't have to be on them for, years and years and years. But if you are, just know that there are those risks of dependency and, potential brain fog, issues with balance and cognition, especially with the benzodiazepines, and may require you to taper off eventually at some point. But I'm glad to hear you got off the Ativan. That's good. All right, Oweas, hello. Can you only get negative symptoms of schizophrenia? Yeah. Well, schizophrenia for the diagnosis, like if you're on medication, the positive symptoms are the easier ones to treat. And then it's very difficult to treat the negative symptoms. So when we're saying negative symptoms, we're talking about like the cognitive deficits, the blunted affect, which is like face is, you're not very emotionally reactive or showing any emotions. You're kind of stuck in a blunted or constricted affect, so you don't respond, to high, things are exciting. Like you still have the same, yeah, that was cool, instead of, yeah, that was great. So your excitability is lower. Other negative symptoms, of course, is depression. So think about that, like low energy, being constricted, lack of pleasure in things. And then, the positive symptoms tend to remit fairly quickly. And then what you're left with are the negative symptoms. So that can be a presentation of someone who's already diagnosed with schizophrenia. But to be diagnosed with schizophrenia, you do need to have, hallucinations as a factor, delusions as a factor, for diagnosis. Um, either two sets of like you're hearing things and seeing things, or like a delusion and a hallucination, like you believe, the FBI is after you and they implanted some bug inside of you and you need to get it out. And you're also seeing, things flying around, and you're that is two levels of positive symptoms. So yeah, that is part of the diagnosis of schizophrenia. But once you're treated, oftentimes, like I said, those positive symptoms, remit fairly quickly. And then you can be left with negative symptoms, and those tend to be more difficult to treat. So you can have a presentation of just negative symptoms of schizophrenia, but you wouldn't be diagnosed with schizophrenia if you just had the low energy, blunted affect, constriction, cognitive, impairment, poor concentration. That would be more of a major depressive diagnosis that would lean towards, not schizophrenia per se, or maybe even schizoaffective, or not schizoaffective, but bipolar depression. Because even with schizoaffective, you need a diagnosis of schizophrenia. So yeah, but you can at one point, once your schizophrenia is being treated, only have negative symptoms. That tends to be common. Okay, Jenny, hi. I tapered Lexapro 20 milligrams in 1 month, stopped at 2.5. Now have severe dizzy spells and brain zaps. How long can I stop this? How long and can I stop this? Um, so you were able to taper from 20 to 2.5. It sounds like in 1 month. Yeah, that was fast. That was way too fast. That's probably why you're having this. So it depends on if we're dealing with the protracted withdrawal now symptoms, because those are going to be a lot longer to manage, or just the withdrawal. So you may have to wait a while at this state at 2.5. You may unfortunately have to go back up to get benefit from these symptoms. And that would depend on the severity and the length of time that these symptoms have been ongoing. But yeah, with going from 20 to 2.5 in 1 month is way too fast. So you may actually be dealing with a protracted withdrawal, but not necessarily. So this could just be a withdrawal. Hold here for, a couple of months. If you're not getting benefit and things are just getting worse, you can try going back up to 5 and seeing if you get any relief. And if you do, hold for a while, and then you're going to want to taper a lot more slowly. And a good guidance, if you don't, of course, I can guide you in a coaching call if you want. But if you want to try to do this on your own, you're going to want to get this book, the Maudsley Deprescribing Guide. It has the hyperbolic tapers that you need to do. And you'll kind of get to see why you don't really notice anything until you get to these smaller dosages, 2.5 milligrams, and then try to jump off from there. It's not gonna happen, especially if you've been on the Lexapro for a long time. But you also want to, another good book is it's on my shelf, the antidepressant withdrawal book from Dr. Greenblatt. I have that in there's a link down there in the description for resources for books, and on my website too for recommended books. I have both of the links to the Amazon where you can get them on Amazon, but those books can really help guide you. The antidepressant withdrawal book from Dr. Greenblatt goes over the integrative approach, which I like to use before anyone starts tapering off, is repleting their nutrients that they need. Then the taper is a lot more tolerable, because if you're missing your cofactors that you need to make serotonin, you're going to have a really hard time coming off of the Lexapro. So definitely something to think about there as well. And I've trained under Dr. Greenblatt. I'm in my second year now with him, and so that's the approach that I use, is that integrative approach, and that's why I do the labs. Can you do them midway through a taper? Yeah, we can try to start repleting, but if this is now protracted withdrawal, you're going to be more sensitive to now trying to replenish your nutrients. So it's a different approach we go at it, but still is important to do the repletion of nutrients when you're tapering. But it's hard to say how long. You will eventually be able to stop it. It's just going to take time. Time is the factor, and kind of figuring out if you have to go back up, or to come back down, or can you kind of hold here and then slowly taper from there. And at this point, I would do liquid compounding of the Lexapro, and then taper that. Hello, Skelly. All right, and okay. Let me get my super chat up. This is a super chat. Let me get my super chat. There we go. Thank you so much for the super chat, and thank you for the support. Let's get to your question. All right. Would taking diazepam for 2 to 4 weeks help out calm down overactivated for long-term, like a short-term treatment? Will it help nervous system stay calm after that? Yeah, so the reason stay calm after that treatment, or the anxiety, panic, agoraphobia bounce up again after that treatment course, it doesn't disappear for some time. So when we're using benzodiazepines, they are supposed to be used. I'm gonna narrow my screen, it's too wide. We're going to be using them. They're to be used for short term. So guidelines state 2 to 4 weeks. Diazepam is going to be longer acting, so it is going to stay in the system a little bit longer, and it's going to be more sedating. So if you are going to be taking diazepam once a day at night, it's going to be more tolerable. So your question is, after that 2 to 4 week period, now what? Like, is my nervous system going to bounce back? Well, it can. Now, the reason why you're doing the benzos for 2 to 4 weeks is to establish in therapy some skills, and to get into some therapeutic modalities that you probably are too hyper vigilant to get into when you're in a panic state. So it does help to calm the nervous system down while you're on the benzodiazepine, so that you can interact well in therapy, participate in mindfulness more. You're doing things to regulate your nervous system in therapy. And then outside of therapy is only an hour long, maybe once or twice a week. So you need to be doing these things every single day outside of therapy. So the work is really done outside of therapy. And so when the medication is done, that 2-week stint is done, or 4 weeks, then you're really needing to leverage those tools, and using, the vagus massage or vagus nerve, stimulation to lower anxiety. You're using, sometimes too, they're also used because you have another medication that it may take a little while, 2 to 4 weeks, like maybe Lexapro or an antidepressant, to work. Okay. So that could be another reason, right? And then, you get rid of that, you're left with the antidepressant there. But the way that I look at it is, sometimes you need pills to build the skills, but you also have to look at not just these skills for mindfulness, meditation, not just skills for using, the vagus nerve exercises and massage and deep breathing. All those things are great, but you also have to make sure that you're repleting your nutrients. And that is a skill. That's a lifestyle, right? So you're going to leverage your lifestyle, whether it be changing your diet and looking and finding out what nutrients can be repleted and what can support you that way is also very important. We can't ignore that. Otherwise, you ignore your nutrients that you need for good mental health. You end up where you're trying a lot of medications and none of them are working or working well, or they stop working, and those types of things. So always repleting nutrients should be foundational. And yes, the benzodiazepines can be used as tools to help short term. But if you're just depending on that alone to help you get over the panic and agoraphobia, then yes, bouncing back again is going to be highly likely, because you've basically taken a pill to replace, like, okay, now I'm calm, now my panic is gone, I'm just going to go about my life, and never really developed any skills or did any work in therapy to also help, to tame down the panic and the agoraphobia, or even find out the root cause of any of it. So that is important to remember and consider. But that is how technically benzodiazepines are supposed to be used. Unfortunately, what tends to happen is the patients, because they work so well, they work so quickly, patients rely on them and they don't want to stop. They want to stay on them. No, it's really helpful. And then, they're not doing the work outside of the therapy session and doing what they're supposed to do. And then, the symptoms bounce back. Another thing you may want to do is, if you're on for 2 weeks and then, taper the last 2 weeks, not because you're dependent or anything at that point, but just, to help you to gradually get back to the skills and learning the skills to utilize, instead of just stopping it completely at that 4-week point and then trying to rely on your skills. It would be better to use for 2 weeks. The last 2 weeks, slowly taper off. And as you're tapering off, maybe have more therapy sessions, but certainly using your tools more and figuring out what works best for you to lower your panic and anxiety. All right, Brian Pellico, why isn't tagabaine used more often, and what are your thoughts? Thank you. I believe this is the psychedelic tagabaine. From what I'm trying to think, I'm thinking of something. I think it might be called something else, um, but I'm not sure. So I don't know if you're talking about the psychedelic or if you're talking about something else. So that needs to be clarified. Um, if you're talking about a psychedelic, there are many different ones out there. I don't think it's called tagabaine. I think it might be called igobaine, but anyway, I don't really know much about all the different psychedelics that are out there. But as I mentioned before, the different ones that are being used, like the mushrooms, the igobaine, I think is the other one that I'm thinking of. And maybe this one, I'm not sure if that's what that is. But I don't know it as a medication. So maybe it's called something else here. But, those you have to be careful with, because they can cause traumatic experiences in that loss of control state that your brain can go into. So that's why they're not more often used. And because they're just not FDA approved. Now, psilocybin microdosing is getting some research is being done. And so that at some point they may find a way to standardize it and use it. But all these other ones that are out there are not standardized. And so oftentimes people are going to other countries to get these treatments done. And so therefore results are varied across the board. And they can be very dangerous. But I'm not sure about tagabaine as a medication. I can't think of a medication. I'm just thinking of a psychedelic. So maybe I'm wrong there. So if you want to clarify that, feel free to clarify it. But I'm just not off the top of my head thinking of a medication that's tagabaine, but maybe there is. It's called something else. I just don't know. Any medications that have a 5-HT2C antagonism? Yeah, Prozac is one that has 5-HT2C antagonism. That's fluoxetine. That's the one I think of off the top because it's the most, it was like the first one with that 5-HT2C antagonism. Um, then there's antipsychotics that also have the 5-HT2C antagonism to help with depression. So like Abilify, olanzapine. That's why olanzapine and Zyprexa, which is Zyprexa and fluoxetine or Prozac, are used together because they have that 5-HT2C antagonism and enhances that. But yeah, even Risperdal, I believe, has a little 5-HT2C. I know for sure the Prozac and olanzapine do, and there probably are a few others, but those are the ones I know off the top of my head that have the 5-HT2C antagonism. Hello, Jenny. Been taking Ativan 0.5 daily for 7 months while I'm struggling to find the correct med to help me when I'm stable with antidepressants. How should and wean? Yeah, that's going to require consultation. That's kind of beyond the scope of this live. But you can find a lot of guidance in that book, the Deprescribing Guidelines book. But you certainly, want to do so slowly. If you've already started tapering the Lexapro, it's going to be best to finish that out. Don't do anything with the Ativan. And then if you want to then later on do the Ativan, then you could taper that down. And it would depend on, the 7 months is considered long-term. So you would want to, slowly get off of it, but you're going to be more sensitive because of your reaction to the Lexapro and your effect there. Your brain is going to be more sensitive to that. But certainly this Maudsley Deprescribing guide that I had mentioned earlier is going to be really helpful for both the Ativan and the Lexapro. It's going to have good hyperbolic tapers in there, good information about what to expect, kind of a thing. So very good information overall about the tapering process itself. So I would say, utilize that, or if you want a consultation where we could spend time like really diving down into this stuff, we could do that too. Just go to levelheadedmind.com under the contacts and schedule an appointment. Okay. Michael Thau, hello. Thanks for all your wonderful content. Thank you. I was diagnosed with GAD not until 55 years ago. Okay. I want to start a medication, but do not want SSRI due to effects and withdrawal. Can buspirone help? Okay, so you don't want to start an SSRI because of side effects and withdrawal. Okay. And with GAD. So buspirone can help, but it does have a lower risk of withdrawal because of the partial serotonin agonism, but still comes with the risk of withdrawal and still comes with the risk of side effects. So it may or may not help. What I would say, Michael, is check your labs, talk to your provider about doing the basic labs for mental health, making sure that there's nothing else going on that's causing this, especially at age 50, now developing GAD, unless there was a root cause of like a stressor that developed it. Oftentimes when we're looking at an older person and you start developing it's mostly because you're probably not absorbing your nutrients. And oftentimes I find this with patients who are older, because it takes time for this to develop of, inflammation driving in the gut with, eating a standard American diet and all that has an effects on the gut. Takes time. But then at some point, you just are no longer able to absorb your B vitamins well, your magnesium well, so looking at your nutrients and figuring out what you need to replete is going to be helpful. And then also looking at if your ability to absorb, like something called leaky gut or gut hyperpermeability, could also be a factor. And I suspect that more in the older population, not that you're elderly or anything, but just that, you, you've had many years of, of damage, like potential damage that could have been done, which under, for chronicity's sake could develop. Now, it can also happen in younger people, especially if you're exposed to antibiotics at an early age and never really repleted, or, and then you're eating a poor diet, as well, that could certainly speed up the process of leaky gut or hyperpermeability. But that can then affect, and cause this anxiety because of the gut brain connection. And I do have a video that talks about this, about, the gut brain connection, that, this is something we do need to be looking at as well. And so, starting first with figuring out what, through blood work, what your nutrients, are that you may need, is a good first step. But then if you're depleted in a lot of nutrients, and you have some, maybe, eosinophils that are high and basophils that are high, and, I'm starting to think of reactions, and would want to look more into, leaky gut and that type of, like food sensitivities and those types of things that could also be problematic, to treat it. So instead of going to medication. And then, of course, therapy, if this was situationally driven, um, maybe there were stressors in your life that compounded and created, the anxiety, then therapy would be the first line, treatment, and doing it, a couple times a week. And then, of course, like I mentioned before, doing the work in between is important, could also be helpful. So I think that, to answer your question directly, buspirone can help, but it may not be the answer. And you still have the risk of the side effects and the withdrawal. So the other things to consider: basic labs for mental health, gut brain connection, would be the two things I would look into. All right. Oh, another super chat. Abdul Rahim. Okay, let's get the super chat. Thank you for the super chat. Thank you for the support. I really appreciate that, Abdul. All right, let's get to your question. Here we go. I take venlafaxine, 225 milligrams, and Trazodone 100 milligrams for sleep, but not working. What is the maximum dose of Trazodone I can take? So you can go up to 375. Trazodone, I'm thinking venlafaxine. Sorry, Trazodone. Sorry, you can go up to, with Trazodone, 600 milligrams, actually. Venlafaxine, you can go up to 375. But when you go up higher with the venlafaxine, you're going to get more trouble with sleep because you're going to be hitting norepinephrine more. So that wouldn't be a good idea. But with Trazodone, you can go up to 600 milligrams. Most people don't need to go that high to get the benefits of sleep. Oftentimes 200 milligrams is where you find that sweet spot for someone, especially if it's, you're taking another medication, that's probably interfering, like, and causing that norepinephrine stimulation in you. You may need higher dosing there to help with sleep. So you could technically go up, to 600, but most people find, at 200 milligrams is where that sweet spot is, especially if it's induced by, medication, like something like Effexor, or venlafaxine, which is Effexor. So, but the other thing I want to say to you, Abdul, is that, as I've been mentioning before, is, to look at other factors for sleep. So look at sleep hygiene, like what are you doing at night, making sure that you're turning off all of electronic devices, not being exposed to blue light, about an hour or two before you go to bed. Make sure you have a 3-hour fasting window before bed. People don't realize that interrupts sleep, and a lot of other things. And then, keeping a cool, dark environment in your bedroom. Maybe you need to wear a sleep mask. Those kinds of things can also be very helpful. And as well as looking at your nutrients. For sleep specifically, I think about magnesium and I think about zinc. So zinc is what's required for serotonin to be converted to melatonin, and magnesium is very important in the stress response. And, when you're not sleeping, your stress response is obviously high, and anxiety is probably a factor. So magnesium and magnesium glycinate tends to be, in my opinion, more helpful for that, for inducing more of a slow wave sleep at night. So perhaps you don't need to increase the trazodone, but perhaps looking at some of those other factors, you may actually benefit there. And then the labs for mental health in general can be helpful, because those are all cofactors that we're looking at for serotonin, like vitamin D, B12, folate, and looking at some of those other factors as well could be very important, along with the zinc and the magnesium. So definitely things to look into, and iron too. When you're starving for oxygen because of low iron, that could also lead to insomnia, but also low energy. So all these things are things to consider, and not just look at medication only as the thing. But technically, you could go up as far as 600 with trazodone safely. That's the dose that's required for the antidepressant effects, is actually between 300 and 600 milligrams. But most people, when we're trying to induce sleep, 200 milligrams will probably be the top there for you. But good question. Thank you. Hunter Gilman, hello. Thoughts on the use of gabapentin 300 milligrams and buspirone 2 times 20 milligrams. So 20 milligrams twice a day, gabapentin 300, with success with Adderall XR for ADHD and Seroquel 50 milligrams at night for insomnia. Is there a better alternative with less pills? Yeah. So a couple things. The Adderall XR for ADHD is gonna be good for ADHD. If you're using gabapentin and buspirone for anxiety, the one thing that could be happening is that they're blunting the effects of the Adderall. So it might be too sedating, because you're doing the opposite here. With Adderall, you're creating a stimulant effect, so which can provoke anxiety for people, which is why I say we need to control the anxiety first before adding in something like Adderall or any stimulant for someone. You may need to increase the Adderall, to leverage that to kind of negate some of these effects. But then at that point now you might be wrestling with the anxiety. Seroquel 50 milligrams at night isn't really going to be affecting the Adderall during the day, because that should be out of your system by night. But it is a dopamine, has dopamine blocking effects, right? But if you're doing the immediate release 50 milligrams a night for insomnia, that's out of your system. So there shouldn't be an issue there, though I don't like using Seroquel as an aid for insomnia, especially long term. We can use it short term. When you're using it long term, you've got a lot of risk for metabolic syndrome and those issues with Seroquel. So is there a better alternative with less pills? Yes, absolutely. I was talking earlier with someone with ASD, which is autism spectrum disorder, and talking about HPHPA and Oates test. An Oates test is also really good for ADHD, because HPHPA could be something in ADHD that could be, it's a neurotoxin off of the Clostridia bacteria in our gut, and we can find it in urinary metabolites. That's what the Oates test is looking for, urinary metabolites of your organic acids. So it can be looking at some microbial areas like Clostridia, Candida, but also looks at neurotransmitter breakdown and synthesis, methylation and detoxification. So that could give us a good picture, background on what could be going on underneath, that maybe you don't need all of these medications, and maybe we just need to tweak something else, because maybe it's something else causing issues with dopamine. And then, of course, looking at your nutrients to support dopamine. So making sure you're getting enough meats in your diet. Phenylalanine and tyrosine are the amino acids you get from meats to help with producing dopamine. And then also the other nutrients, of course, are going to be your vitamin D, your zinc, the B vitamins, B12, B9, which is folate, and omega-3 is super, super important for ADHD, brain health. So repleting all of those nutrients are going to be very important for you. Magnesium as well, if I didn't already say magnesium, very important and key. And making sure copper isn't too elevated. So zinc copper and zinc copper ratio would be good. Now, repleting all the nutrients can be very helpful where you may not need a lot of these medications, but you are going to have to, especially gabapentin. If you're going to, start reducing that, reduce it slowly, so you don't get into the withdrawal, and then see if you start gaining more benefit from the Adderall. Now, the other thing too is if you want to start leveraging nootropics and things like the OPCs that I mentioned earlier for brain health, that's using the oligopolyscienthionines, OPCs, which is basically like the polyphenols sources from the foods, like the purple and from grapes, so grape seed extract, pine bark extract there's a formula that I mentioned earlier, curcumasorb mind, that can be very, very helpful. You could utilize something like that to help. And that also has some of those cofactors we talked about as well. And then Dopa Plus is another one. That's from Pure Encapsulations, and Dopatone by Apex Energetics. Both of them I find work well with increasing dopamine primarily, and can help boost the effects of Adderall, or even be something that a lot of people use when they don't want a stimulant. They don't want, something that can exacerbate maybe their other symptoms. So those are some ways you could do. So you could do it naturally. You could try increasing the Adderall. If you're already at a high dose of Adderall, then you probably want to start looking at these other medications potentially. I would start with gabapentin is probably the one that's really blunting the effects of the Adderall, and seeing if you can handle lowering that dose a little bit more. And then because the 20 milligrams of Buspirone twice a day is pretty good, you could technically go up to 30 milligrams twice a day if needed there. But I would work on that gabapentin because that is a central nervous system depressant and is actually counteracting those effects of the Adderall. So see if you can manage your symptoms with trying to lower that gabapentin. And then just for longevity of this treatment plan, I would look at finding other ways to support your sleep and try to get rid of that Seroquel, because Seroquel long term, I think of metabolic syndrome and all the effects that it has on your health negatively in that regards. So, looking at sleep hygiene and then those cofactors and all those things we talked about as well. But yeah, you could certainly try to get off of, the excess meds. Okay, Megan Duncan, hello. Another super chat. This is wonderful. Here we go. Thank you so much for the super chat. Thank you for the support. All right, so Megan will answer your question. Okay. So Megan, what's the therapeutic dose of Prozac for anxiety? So therapeutic dosing for Prozac when we're trying to target anxiety, 20 to 40 milligrams could be, good therapeutic dose there. When you start getting into higher doses like 40 to 60 milligrams of Prozac, you could get benefit with anxiety. I mean, many people do, especially when you start at 20, you get, and then you kind of slowly go up and it stops working and you need to increase the dose. You have to titrate it. But oftentimes that's reserved for like someone with mixed depression and anxiety, because you're going to get a little bit more of that norepinephrine with that 5-HT2C antagonism. Someone had asked about that, but that's basically what you're doing there is it's a downstream effect over time. You're going to increase just a little bit of norepinephrine. And so that can, be a little stimulating for some people. But, 20 for anxiety, only generalized anxiety disorder, 20 to 40 milligrams can be very therapeutic. If you're going to be treating anxiety mixed with depression, you're going to probably need those higher dosages, 40 to 60 milligrams. But that's a good question. Thank you, Megan. All right. Cynthia Nathan, hello. I am also on fluvoxamine 125 milligrams and mesulpiride 25 milligrams and pregabalin 50. Okay. Which one to taper first, SSRI, antipsychotic, or benzo? Good question. Okay, so if I'm looking at all of those medications, benzodiazepine is going to be the most difficult to taper off. That being said, what was that dose of the benzo that he's on? Oh, you're on you're on pregabalin 50, which is a gabapentin. Yeah. So I would start with that just because, and the reason why you would start with like a benzo when you're looking at the whole picture. If you haven't started yet and you haven't exacerbated anything or caused, any issues, because the other, when you start lowering the others first, like, cause it would probably be easiest to get rid of the amitriptyline first. That's the antipsychotic. That would be the easiest. Fluvoxamine second, and then, wait for the pregabalin, which would technically be the hardest to come off of. But when you're coming off of these other ones first, you're creating changes in the brain, and the brain has to adapt. So you have to do it very, very slowly. But then when you're off of it, and like say you're in the adaptive phase, but you're feeling okay, and then you start now getting rid of pregabalin, which is going to bring glutamate up, which is very excitatory, and you have nothing to dampen glutamate down because your brain is still trying to heal from the serotonin homeostasis, that balance of serotonin, and even dopamine to a point with the antipsychotic. That's going to be more problematic. So when you're on a bunch of medications, it is best to start with the one that would typically be the hardest to get off of first. That's my opinion, and that's what I like to do. Some people will say to try the easiest one first because it builds confidence in the person to taper to begin with. Because coming off of the pregabalin first is going to be a little more challenging. So it may turn you off to wanting to taper the other medications. So that's like the psychological side of things. But I like to look at things like physiologically speaking, what's going on in the brain and the body. When we're coming off of Lyrica, which is the pregabalin, we want other medications there to support the excitability that's going to happen as you start tapering that off. And then of course you're going to want to taper off slowly, like I mentioned. And that guide that I had mentioned earlier, the Maudsley that I keep beside me more and more now, is going to be very helpful with hyperbolic taper. And it is going to require at some point switching over to liquid to do it, and you have to do it slowly. What a mistake that people make when they're tapering, unfortunately, is they taper too fast, and that's across the board with anything. And I mean, like, I had someone who was like really upset that Lyrica, made him feel worse. Okay. Instead of making him feel better. He's having rebound anxiety, rebound issues and symptoms. So wanted to get off of Lyrica. So once started a taper, wanted to get off fast and was going too fast. And that made things a lot worse. Then switched to liquid. And then I thought got off of that too, was too fast. So then it was like at that point, now they're protracted withdrawal and now everything's a mess, and so that's the one thing I have to say. No matter what you decide to taper with first, if you want to build confidence and taper with the easiest one first, that's fine. Just make sure you're doing it very, very slowly and you're giving yourself time in between each one of these, at least 3 months in between, so your brain can establish homeostasis and feel better, and also nourish before even starting. Okay, before even, I would say, replete your nutrients. Look at your diet, look at your lifestyle, start setting up your lifestyle so that you're going to support your mental health. Because the other thing to consider that I think a lot of people forget is that the medications were started for a reason. So the question is, did you work on that? Did you work on your depression? Did you work on your anxiety? Um, is it, if it's bipolar, did you work on your sleep and your circadian rhythm patterns, and making sure that you're not going to be switching into hypomania? Like, what are the things that you're doing to support wanting to come off of medication and be without medication? Because whatever those underlying symptoms were that you started the medication for will come back, and oftentimes with a vengeance. So you need to make sure you have skills in place, also nutrient cofactors, and optimizing your diet, exercise, those types of things, which are basic, but no one does them. Okay, honestly speaking, unless it's like the point of no return and now they're desperate, then that's when they want to start them. But really, you should be doing these things first. So do that first, then work to, slowly start tapering. But in my opinion, I like to start with the most difficult one first, because you're going to have the other medications there to kind of help dampen down, especially with the benzos, and pregabalin isn't a direct benzo, but it does act on GABA similarly. So it's going to create some excitability with glutamate. So it might not be a bad idea to have the imesylpuride and the fluvoxamine there to help dampen that down. So I know it was a long answer to the question. Oh, we got another super chat from Jenny. Hi, Jenny. Thank you. Super chat. Oh my goodness. Okay. Thank you, Jenny, for the super chat. All right, let me see. And we have a question. Okay. All right. Viibryd 40 milligrams the last 2 days. I'm feeling a little better. Okay. Yep. I'm trying to keep that in my mind, because you're also getting off Lexapro too. Okay. A bit less anxious and haven't cried for on 3 days. Does the Viibryd, I think you mean Viibryd, have the chance of eliminating the anxiety like Psychedelics did? Yeah, it does. It does have the ability to do that. It's a serotonin modulator, but has also effects with that partial serotonin agonism. So it can actually, and that 40 milligram dose is the top of the, so when I was saying earlier to you, make sure you're up on the dose, so you're at 40 milligrams. So that is, basically top dosing for Viibryd. The other thing with Viibryd that I just thought about, because I thought of a patient who wasn't eating with it. You need to make sure you're eating something with Viibryd, because if you're not, you're only getting half of that medication or even less metabolized. So Viibryd needs to be taken with food. So that is super, super, super important. So if you're not getting any benefit from it and you're not taking it with some food, make sure you're taking it with food. And when I say with food, like, make sure it's a little substantial, like with the whole breakfast or with the whole lunch or something like that. That's another helpful tip with Viibryd. And then I would say that, giving it that full 8 weeks, I think you had mentioned 5 weeks you were on it, and then it seemed to like wane, or maybe you're not getting more. Just wait, hold on a little bit longer. And if you're also trying to taper Lexapro, that can also be causing some challenges as well. So I'm not sure if you're the same person that was doing the Lexapro as well, but just, something to consider. Yeah, you did. Okay. So I was right about that. Okay. I'm trying to put the whole picture together now with everything. It's hard to remember everything off the top of my head. And I didn't drink my green tea today, guys. So I think that's probably why I'm slipping here. But yeah, okay. So the Lexapro, you're tapering off that, you're down to 2.5, you're experiencing those symptoms of withdrawal. That could also be the problem with why Viibryd isn't helping as much as it should, because your body's trying to figure out its homeostasis, and you kind of went down quickly on that. So I do think that you really do need to focus on your nutrients to support this transition to get off of Lexapro, and to also support the use of the Viibryd. because I'm guessing you probably do need some cofactors to support, serotonin production, especially because you depleted it when you got, you came off of or came down from Lexapro too quickly. And so you need to replete with nutrients to support that adaptation in the brain. So definitely look into, like I was telling you, Dr. Greenblatt's book on the antidepressant withdrawal. That's going to go over it like step by step on nutrient repletion and how much you should do. I mean, that's what I use for nutrient repletion. So that'll give you a good guidance there. And then the other thing that I was going to factor in too is the inflammation that occurs. So when you are withdrawing from a medication and you're having those symptoms, like you mentioned earlier, like the dizziness, the blurred vision, like, all of these things, neuroinflammation is what's happening. Your brain is trying to adapt, and now you've created some inflammation in the brain from this. So we want to also focus on reducing brain inflammation. And one of the best things you can do for that is omega-3 fatty acids, high potency. So I'm talking about 2,000 milligrams to 3,000 milligrams. Some people will gain benefit at 6,000 milligrams of omega-3s. So, and I know that that's a lot, but there are, Carlson Labs has a super omega elite in liquid form. 1 teaspoon is going to give you 2,700 milligrams of omega-3s, and it's going to give you high potency EPA and DHA, which is what you need to dampen down the inflammation. There's another one that Carlson Labs makes. It's called omega-3 MD. And I'm not sure if that's to the public or if that's something you'd have to get recommended by a provider, but it also has a high potency of omega-3s. Both EPA and DHA are both equal. I want to say it's 1,200 of each of those. And then plus it has some others. So I think it might be 2,900 milligrams total in 1 teaspoon. So you can see how, you can utilize that, because if you're going to use other ones that are out there, which are good too. I actually like Dr. Amen's Brain MD omega-3 has a lot, but it's 2 capsules and they're huge, so you would have to do like 2 capsules twice a day to get like the same amount as 1 teaspoon of the Carlson Labs Super Elite Omega in liquid. So, and then like looking at cost effectiveness there too, I think that's probably going to be better, but you can gain a lot more with using omega-3s to dampen inflammation. I think omega-3s are underutilized for brain health and brain inflammation, but definitely can be very helpful here. And then you don't want to ignore the things that you can do to help reduce your inflammation and anxiety, like vagus nerve exercises. I'll go over a set that I do because it only takes a few seconds. So we go around the eyes here and we tickle. You close your eyes and now you're kind of tickling, awakening the vagus nerve. After doing this for about like 10 times, move to your ears and you take your hands like this, 1 finger in the front, 1 finger in the back. Now you're directly stimulating your vagus nerve. Keep your eyes closed. You can go as fast or slow as you like here. I like to be a little aggressive with it because it really helps stimulate my vagus nerve. I can feel it. You get a tingling sensation, calming sensation. After doing this for at least 10 times, you move to the back of your head where your head meets your neck there, and you just circular motions like this, the back there. That's going to help open up your cranial nerves directly innervate here through here, and then go down. But also there's the lymphatic tissue and things get clogged up here that can decrease brain flow. So this helps with that. So I do that for at least 10 seconds. And then I go slowly down the throat, the middle of the throat. I'm not squeezing or anything, just gently going down the throat. Keeping my eyes closed, feeling this relaxation come upon me. And then deep breath. Ah. And then do the ah exhalation. Very good, quick vagus nerve exercise. I feel myself buzzing. My heart rate's probably gone down. You can see it go down if you check before. I always forget to do that while I'm doing it live so I can say what it is before and then after. But it does, help with that because vagus nerve are the brakes to the sympathetic overdrive, which when you are going through withdrawal, anxiety, those kinds of things, you are in sympathetic nervous system hyperdrive. So we need to put the brakes on it. That's what vagus nerve does. It activates parasympathetic nervous system. And those points that we touched on with this exercise really helps to say, okay, we need to be calm now. Let's calm things down. You can incorporate deep breathing as well to activate vagus nerve, some diaphragmatic breathing. There is a really good YouTube channel that I love for vagus nerve exercises. It's lifestyle yoga lifestyle with Melissa. She's got 2 channels, but that one, the yoga lifestyle with Melissa, she has a lot of stuff for nervous system reset, yoga specific exercises for vagus nerve. And she has a lot of these tricks, little vagus massage points for anxiety, insomnia, and just general health on her channel. So I would say look that up and you could see some of these exercises. And the vagus nerve exercises specifically aren't that long, a couple minutes at best, and then but the yoga ones are lengthy because she goes through a whole exercise with the nervous reset yoga and the vagus nerve yoga specifically, about an hour long, but totally worth it. You're going to feel a lot better. You're going to learn how to regulate your nervous system. That's what we really need to do here when we're dealing with anxiety, PTSD, agoraphobia, like kind of like the theme of the day today, right? We really want to tap into these tools and these skills to really dampen down the anxiety and to help with the nervous system, resetting the nervous system, lowering inflammation, because the vagus nerve also will do that. So doing these exercises daily is going to be what's best. I like to do it, in the shower because I'm washing my face. My face is slippery, and it goes a lot smoother. And then during the day, if I start noticing like my shoulders getting tight, my jaw getting tight, like I'm feeling anxious, I'll stop and do it real quick, just like I did here. And then that helps to calm things down and you can feel your body getting calm. And it's also like just taking a moment to be present in your body. So do not forget about those tools that you can leverage as well. You will gain much, much benefit there. But I do think that, yes, Viibryd has the capabilities. I've seen it help with anxiety, very similar to how, Trintellix did. Trintellix is a little more robust in that multimodal action that it has, but Viibryd can also do that. But you also want to look at your whole clinical picture as, looking at it from, stepping back and saying, well, why isn't the Viibryd working? Maybe it's because your brain is overactivated, still trying to adapt to that coming off of that Lexapro. And so you got to honor that and just, give your body space and time to heal, and then also replete your nutrients as we discussed. Sorry, I know it's a long answer to a question, but I think it's important because it helps a lot of you out there that are dealing with similar things. So thank you for that. Megan, hello, another super chat. Thank you, Megan. Yay. All right. I have been having severe anxiety. Hold on, it gets blocked off. Here we go. Okay, I have been having severe anxiety. I'm on Prozac 20 milligrams, Clonopin 0.5, and Abilify 5 milligrams daily. My doctor wants me to add 100 milligrams of Wellbutrin for more improvement. Should I try increasing my Prozac first? Okay. For severe anxiety. Yeah. Okay. Yeah, increasing the Prozac first would be my go-to. When you add in Wellbutrin into this mix, you actually are going to cause 2 things. The Abilify and the Prozac, and there's going to be some drug interactions you have to be careful with. because of the 2d6 of the Wellbutrin, the inhibition that's going to cause on both the Prozac and to a lesser degree the Abilify. But that's a concern. And maybe that's what the provider's thinking to leverage a little bit. Then you wouldn't want to increase the Prozac at that point. But again, you're adding in another medication to this already. You're already on 3 different medications. And when we're talking about severe anxiety, if there isn't an antidepressant component here or some other component where we want to leverage dopamine and norepinephrine, this could actually create more stimulation, because now you're actually going to get with the Prozac, you're already getting with the Prozac and Abilify some 5-HT2C antagonism. So you're getting a little bit of norepinephrine there. You throw Wellbutrin in here, you're going to get even more norepinephrine. So really, that can be stimulating. And so we really don't want to do that. Now, with SNRIs, if you're directly stimulating norepinephrine and you flood the brain with norepinephrine, as some of the SNRIs do, that can actually be sedating. So I can see that. But if we're just increasing a little bit by the 5-HT2C and then adding in Wellbutrin, we're actually creating a little more stimulation than sedation. So that is something to consider. So if I were you, or if you were my patient and I'm looking at these medications, yes, I would look at increasing Prozac first. And I don't even know with the Abilify if I would even want to, I would look at maybe lowering that to 2 milligrams instead of 5. I don't know if you started with 5 or if you started with 2 and maybe it wasn't helpful, but I would even look at lowering that to 2 because I know, 2 to 5 milligrams are a little more sedating, but 2 is even more sedating, than 5. So to kind of help with that, because once you start going above 5, you do get more stimulating effects from Abilify, and unfortunately, which can be helpful with depression, but unfortunately with anxiety, not so helpful, and can even cause something called akathisia, like someone asked in the very beginning about akathisia, very, very restless agitation, internally, that's very uncomfortable. So yeah, I would look at that, increasing Prozac and entertaining the idea of lowering the Abilify to 2 milligrams. That would be good. And then of course, like we talked about before, with all of the pillars, the foundational things, sleep, your skills, your meditation, hopefully you tried the vagus nerve exercise while we were doing it and while I was doing it. Hopefully you guys were following along to lower anxiety, and your nutrients, like we've talked about all today, with making sure you're not depleted in your nutrients as well. But yeah, certainly increasing that Prozac could be a good option, better option in my opinion than adding in Wellbutrin right now. It's a good question. Thank you. All right, so we're at 101, 102 with time. So we're over our 2 hours, but I'll answer a couple more questions. Not sure how many we have left, but yeah, we're rounding out here. Debbie Lease has a question. Stopped Remeron about 2 weeks ago as it was helping sleep. Now feeling really depressed. Just feel overwhelmed, taking supplements and Klonopin, but not helping. So you stopped Remeron about 2 weeks ago. Yeah, so now if you're feeling depressed from that, it's probably from the withdrawal from that. Hopefully you did, taper it down slowly, but if it's only been 2 weeks, I wouldn't throw in the towel just yet. But wait a little bit longer for things to come back online in the brain. Before saying that, that things are not working, because 2 weeks is very early on in this whole withdrawal, coming off of medications type thing, and changes that are going on in the brain. It does take some time. So, give it at least a month or 2. I'm not sure with the supplements that you're taking. I believe I have worked with you before. So if you're still taking those ones that we talked about for serotonin modulation and helping that, that, that certainly is going to be helpful. But that's been a while since I saw you. So we may have to redo labs to see where you are now, because I'm pretty sure that was over 3 months ago. And then, of course, clonazepam thrown in there can be helpful with anxiety, but can also have rebound effects, and also can maybe make the depression symptoms seem a little worse. But what I would say is that if this has all happened with the 2-week change, like 2 weeks ago, and then like things kind of seem to fall apart, hang in there. They will start to get better with time, and we would have to see how you tapered off of it. You may need to go back up, to your last dose of the mirtazapine, just to help ease that in, and then maybe lower the rest of it a little more slowly, to try to taper off of it a little more slowly, if that's what could have created the depression symptoms and this feeling of overwhelm. But I would say hang in there, because typically it does get better, with time. So we do have seems like many questions left. So I'm not going to be able to get to all of them. And what we'll do is, like I've said before, my newsletter, I'm going to answer at least 4 of these questions that are left in the newsletter. And so make sure you're signed up for that. You'll also get articles. I only do like a newsletter once a month, maybe twice a month if there's something I want to share with you guys, but not too crazy there with spamming people. So if you want to sign up for the newsletter, go ahead and do that at levelheadedmind.com. At the very bottom, there's a footer there where you can sign up for the newsletter. You'll get a free tip sheet on resilience. So some good information there. But I thank you all for being here. I thank everyone who contributed to supporting, this live with the super chats. That's also very, very helpful. And hopefully I'll get to work with some of you. Some of you have asked about how to work with me, levelheadedmind.com. Go to the contacts there. You can schedule a consultation on my calendar. If you want to see me and you're in Florida, down at the bottom of that contact page is the information for my Florida office here in Vero Beach. And depending on what you need, we may need to see you in office, but a lot of stuff can be done telehealth as well here in Florida. The consultation outside of Florida, those coaching consultation sessions, the initial is an hour, and then the follow-up, depending on the time that you need, half an hour to an hour. But that's all done obviously by telehealth as well. So hopefully I'll get to work with some of you a little more in detail and go from there. But hang on to hope, everyone. There is still hope out there, and utilize some of the exercises we just did to help with your anxiety if you're having any anxiety. And I'll look forward to seeing you next month. So the third week of the month is going to be in September. It looks like the 21st. Yep, the 21st. We'll do another live as long as Raul is available, and we'll do that at 11 a.m. Eastern Standard Time. So I'll also make sure that goes out there, and he says he's available. So we will be doing that September 21st at 11 a.m. Eastern Standard Time will be the next public live. I'm always happy to help you all and to see you all here supporting the channel. And hopefully I'm helping you and supporting you with your mental health, because that's all, ultimately the goal. And you can also become a member. One member we had today, Buffy, she was a member. She just joined today, which is great. But you'll get access then to some of the things that we do on Members Live, where I answer in detail, specific questions about things, and do a whole presentation on it. And so you get a lot more detail, and then you can have one-on-one lives with me as I'm presenting whatever it is that you guys, need help with. And if we don't have questions, and I just teach you things, like the last one we did was about vagus nerve and breathing your way to calm. So how to use the diaphragm, how to do vagus nerve exercises, and all of those things. That was a really good one. That was that was the first Saturday of the month. I do those. So anyway, lots of stuff on there, and that's only $4.99, a month for that. And you can cancel anytime. But anyway, great seeing you all, and thank you all for being here. God bless, and we'll see you next month. Take care. Bye-bye.